policy is so bad that it is spending more on defense than it is on health. And so the problems are linked. And I'm afraid I'm not the solution. You are the solution to this 80%. So I'm just throwing the case back at you. I should be asking you, why are you not acting more to get rid of the 80% in tertiary and put 80% into primary in the world? We have time for a second round. Lehigh, do you have any questions? One question from there, please.
Yes, Mr. Ambassador. Related to the genocide that is ongoing in Darfur, what has the UN or WHO done to curb the health implications that have arisen from the devastation there, especially to women? Could you speak a little on?
Yeah, I'll take a second question.
We thought there was just one question per second round here.
I see. Okay, but I'm very impressed by the turnout in Lehigh. Congratulations. You obviously have a dictatorial professor. And that,
very interested students.
Very interested students.
I see. Okay.
Thank you, sir.
I'll take your word for that. My suspicion is that you twisted their arms and promised them with incentives or with death if they did not attend. The Darfur problem. The Darfur problem, we should take it as a generic problem, not as specific to Darfur. The Darfur problem is the following. When you have cases of man-made disasters, where you have created a situation in which people are killing each other or there is war, you are inevitably going to have displacement. And that displacement creates either refugees or internally displaced persons. You know, the difference is a refugee is a person who leaves his home and goes out of his country, and an internally displaced person, or IDP, is a person who leaves his home but is then put in a camp or somewhere but inside the country, hasn't crossed a border. Most of us believe that these definitions should not exist, that anybody who has to leave his home should be called a refugee. But these are legal definitions. Now, what happens if a situation like that occurs? You have to concentrate them. The same thing in Katrina. You have to concentrate the people inside a church, inside a school, inside a camp, but in some place where people are going to be lumped together. Now, lumping together is the most serious vector for health problems, even in the most developed countries. And that is why one of the most serious things about health concerns is if you are in hospital, because a hospital is a lumping together of people, all of whom are diseased in some fashion. That's why so much emphasis is put in hospitals on sanitation, etc., because it is a disaster area. It is a concentration camp of the sick, whereas Darfur camps are concentration camps of the poor, displaced, etc. And you are going to have a huge health problem in these camps. Firstly, because the water supply is not piped. When you are in a camp, you are going to be supplied in water by some method which is probably trucked in water. And who knows what's in that trucked in water? Where is the water coming from? What were the germs in the truck when the water was put in? What is the quality of the water? How had that water been infiltrated? From where was it picked up? From a well which already had arsenic in it, as you have in Bangladesh. You have wells which have arsenic in them already. And so you are going to have water which is not uniform in its piped, safe content. Secondly, you are close. And because you are close, if I have the disease, contagion will spread. And contagion spreads not because I touch you, but because I breathe out and you breathe in. Or I touch the tent and you happen to pass and touch the tent also. So by hand contact or by breathing contact. And these are very strong vectors of spread. And so you find that in all camps in the world, traditionally, you find the disease spreads. And all our efforts are aimed at crisis management of the disease. Crisis management means watching typhoid and cholera, because these are really tough diseases. If you get typhoid and cholera, it's going to spread like wildfire through the camp. But you have other diseases which spread, which don't spread like wildfire, and which we are not watching. For example, tuberculosis. Tuberculosis is a contagious disease, but it does not show up its results for quite some time. And so if you find that there is nobody who apparently has tuberculosis, you are not even aware that a vector is spreading tuberculosis in a camp, and that 2 years later, everybody is going to fall sick. And TB is a bad disease because it wastes away the body, and it impacts on your energy and strength and capacity to work, and thereby to earn money. So TB is a horrible disease again, and it's a primary healthcare problem, because you find that it spreads most in countries which have poverty. Because here in the United States, one man was suspected of TB, and it set up a national manhunt. And within days, we had constricted and identified all those who had come into contact. Well, you are in a country like Pakistan, where there are thousands who have TB, and nobody knows who has it and who doesn't. And so you can't control it. The vector is too large, and therefore it cannot be addressed. And so your question about Darfur is an important question, but it relates not to Darfur, but to the generic system of people concentrated in regions or hospitals or camps where it's going to spread. Now, once again, our effort in places like Darfur, primary effort is food. Because if you don't have food, you are going to die. Sorry, I would say secondary is food. Primary is water. You have to give water because you have to produce water within 24 hours. Secondary is food. You have to produce enough food within 2 days or people will die. Tertiary is health because, it's a different type of crisis. Over to Lockhaven for questions, or a question from Lockhaven.
Yes, hello. Climate change has become a serious threat to world health. In low-lying coastal areas, especially in Southeast Asia, rising sea levels will inevitably force large numbers of people to leave their homes and move. I was curious if any preparations have been made to accommodate large movements of people as far as containing the outbreaks of disease and the potential health problems that would arise from that.
The simple answer is no. The problem of global warming is a major problem, and the problem of coastal areas is even bigger. Almost half of the population of the world lives in coastal areas, and all coastal areas will be submerged, and in almost all cases, you will either have to walk in or swim. And so all that you can do is to strengthen your legs for walking and your arms for swimming. But there is no solution to the problem of coastal areas, because all coastal areas will ultimately get flooded, and our only hope is that global warming comes in slowly so that the sea level rise is so gentle that people can walk in, not suddenly as in a tsunami, but over a period of 50 years. And so to all those of you who are in Lockhaven, so you're okay. But those who are close to the sea, as in New York, had better learn how to swim long distance. Over to Montclair for a question.
Hi, this is actually regarding United States healthcare. We have one of the highest infant mortality rates in our country, which is very sad. Why is this happening? What can be done to prevent this? And what can we do to help this?
I'm not sure I know the source of your statistics, because you said United States has the highest infant mortality rate.
I said
compared
one
to,
of the highest, not the high, one of the highest rates, not the highest.
Yeah.